Morning to all. Today we are going to discuss about Raynaud's disease. It is a recurrent vasospasm of the fingers and toes, usually occurs in response to stress or cold exposure. It is named after Maurice Raynaud, who was a medical student, defined the first case in 1862. The Raynaud's phenomena is used to refer to localized intermittent episodes of vasoconstriction of small arteries of the feet as well as hands that cause color and temperature changes. The disease is most common in women between 16 and 40 years of age. It occurs most frequently in cold climates during the winter season. Classifications of Raynaud's disease are primary Raynaud's disease and secondary Raynaud's disease. Primary means occurrence of vasospasm alone with no associated disease condition. Secondary means it will be associated with other disease like autoimmune disease, example SLE or rheumatoid arthritis. Predisposing and precipitating factors include working with vibrating machinery. Here, the fingers may go into spasm due to an intermittent lack of blood supply to the fingers. In case of emotional distress, exposing to cold temperature or cold climate, women are affected more often than men. Exposure to chemicals such as PVC, silica, then smoking, autoimmune disease may also develop this particular disease condition. Pathophysiology of Raynaud's disease are predisposing factors such as age, gender, and the climate, and the precipitating factors like smoking, working with the vibrating machinery, emotional distress, exposure to cold climate. Women are more affected than men. So these are the precipitating factors and predisposing factors. In such a condition, the person may be develop stress, digital artery contraction spasm, and finally occlusion of arteries, and so the tissues may get ischemic. Signs and symptoms include the fingers and toes will be affected more. Rarely the nose, ears or lips may be affected. The affected body parts will usually have two or more of the following changes: look pale due to lack of blood flow, look bluish due to lack of oxygen, feel numb, cold or painful, redden as blood return to the affected area. Patient often describe three phases of change: initial white vasoconstriction followed by blue cyanotic changes, then red due to rapid blood reflow. So here these are the phases: first phase, second phase, and the third phase. Diagnostic measures include history collection and physical examination. While history collection, we need to obtain a history of injury or frostbite, obtain occupational history, industrial exposure to polyvinyl chloride, and whether the person has any other autoimmune disorders. While doing physical examination, observe the color changes of the digits and observe the presence of ulcers. Examine the nail fold capillaries under magnification helps diagnose underlying autoimmune disorders. Laboratory investigations include complete blood count, ESR, anti-nuclear antibody, rheumatoid factors. Medical management: avoid particular stimuli like cold as well as tobacco, calcium channel blockers like nifedipine, topical nitroglycerin 1% or 2%. Nursing management: the client is encouraged to avoid exposure to cold, avoid repetitive hand movements and stressful situations, quit smoking and avoid secondary smoke as nicotine is a potent vasoconstrictor. Stress management: example, you can use biofeedback, assist in alleviating some distress from the condition. So far we have discussed about Raynaud's disease, definition, risk factors, then precipitating factors, predisposing factors, pathophysiology, diagnostic measures, clinical signs and symptoms, then medical as well as nursing management. Hope you have understood. Thank you so much.